Hey everybody, Dr. Daniel here at the Neuropathy Clinic at Fix Me, and I'm going to talk today about two types of patients. First type of patient, they've already seen their primary care provider, they've already gone to the neurologist, they've already seen the specialist, they've already gone through other programs that promise them a cure, and yet they are absolutely not ready to give up. They're going to do anything and everything to get better. Those patients are great because once they're given a plan that works, there's nothing that can stop them. These patients make our lives easy because they do the work, they do a great job. The second type of patient, they want to think about it. They always very frequently ask, do you have research? And I have to be honest, as an engineer, that was my first degree. I don't care about research. Certainly engineering did rely on research, but at some point things just come into common practice because they work. So I would be considered an implementarian, meaning I don't care what the paper says, I don't care what people say. All I care is, does it work? And again, we've talked about the success rate before, but there's been over 10,000 patients that have gone through this treatment protocol, and the success rate is over 94%. I will say though, when we talk about the types of patients, we don't work with this type of patient anymore because everything's a question. Instead of working the plan, they're questioning the plan, it's just everything's resistance, and that's fine. That's fine. You're certainly welcome to ask questions, especially when we're starting out. That's up here before we get into this, but at some point you either have to decide you're gonna push the chips in and you're gonna go after it, or you don't. And so the type 1 patient goes after it. Nothing's gonna stop them. And when we talk about all of this, 5%, 95%, what does that mean? 5% of life is a plan, and 95% of it is our mindset. We're going to be unstoppable, we're going to be unbeatable, we're going to get it done no matter what. And these patients have that mindset. They get into the plan, they work the plan. Sometimes, yes, questions come up in terms of how to implement the plan or things that we need to adjust or adapt patient to patient. Perfectly fine, absolutely. However, these people, type 2, will never trust the process. The process works. That's not in question for me. I wouldn't be doing it, and I wouldn't still be promoting it if it didn't work. It does. So we see relief. Sometimes we see relief for people who've been suffering for 5, 10 years within as little as a week and a half to 2 weeks. Yes, those are outliers. That's extremely quick. Overall, though, we see well over 90% get significant relief in a very short period of time. And again, that comes from people willing to take the leap. You gotta trust the process. You have to believe that it's gonna work, not because it doesn't work, but you have to believe that it's gonna work so that you can implement it effectively, that you can make the changes that you need to make, that you can commit to the program. And I know this is a little bit rah-rah, but that's the reality, because it comes back to 5%, 95%. You gotta have a plan. You have to have a plan. But once you have a plan, it's all about mindset and discipline. It's like, oh, I don't have the willpower. It's not about willpower. It's about being able to get up day in and day out and say, okay, this is what I'm gonna do this morning. This is what I'm gonna do this evening. Not like it's hard, but it requires consistency. And consistency comes from discipline. And that's one of the other things that the way our program is set up, it helps people become disciplined. So if you think that matter of fact, let me rephrase that. If you know that you're in this first group, click the link below. We're going to be able to help you because you're going to be able to help yourself. If you're over here still thinking about it, that's fine. Do more research. If you get to the point where you come over here and you've decided, hey, I'm going to do it, I'm going to do anything and everything, and nothing's going to stop me from getting better, getting relief, we're also here to help. Again, at the end of the day, it comes back to mindset. And mindset overwhelmingly drives the process. Again, you could have the best plan in the world, but if somebody's like, oh, I don't know if it's going to work, or constantly doubting it, that makes things difficult. Because to a certain degree, we do create our realities. And so, and they certainly understand if you've been in pain, you've been suffering for a long time, and nobody's been able to help you. I can understand how it's difficult. Again, we'll play back to that number, over 10,000 patients. Now, obviously, we haven't treated all those patients. We've only been doing it for a little over 2 years now. But there's over 500 doctors that use this protocol or something very similar to it to get results for their patients. And it works. People get relief, people get out of pain, people able to sleep, be able to get their minds back because they're not always worried about and suffering from that pain. So if you'd like to get checked, see what we can do to show you how you can help yourself, then give us a call. Click the link below. But again, you need to be on this side of the whiteboard and not over here, because we're not able to help people who aren't ready to help themselves. Okay, thanks and have a great day.